Hey guys, what's up? It is your girl Lock Looney Tune, and today is Saturday, January 26, 2013. It's about 1:45 in the PM, and I'm gonna tell you what happened to me yesterday because I really had a busy day yesterday as far as doctor's appointments and finding out information about what's going on with a lot of things. So let's start off with my physical therapy appointment, my very first physical therapy for my right knee. Um, as you guys know, I was already having trouble with my right knee with some pain and some discomfort. So my primary care physician referred me to go to see a physical therapist. My first visit was yesterday, and I posted some pictures on Instagram while I was there. She pretty much had me on a table, uh, trying to see where the strength was in my right leg. And also she took me into another room because the physical therapist is usually, it looks similar to a gym, but not really. It's like using different exercises and different tools to help you with strengthening whatever muscle you may be or joint you may be having trouble with. So while I was doing the therapy, she was telling me pretty much what she thought my problem was with my right knee, and she said my muscles on my right side, like my right leg, pretty much the adductors, which are the muscles on your thigh that go outward. Those are outer thigh muscles, the adductors. She said they're pretty weak. And I told her, sometimes it feels as though my balance is off. And sometimes my knee gives way. And she said that's because I need to strengthen those muscles. So she gave me I don't even have the paper. I don't have the paper with me, but she gave me a few exercises that I could do to work on those muscles to strengthen my leg, like standing behind a chair, trying to balance on one leg, trying to do like leg exercises on my side, laying on my side, and leg lifts and stuff like that. And I already do those. She said it's not as bad as she would think, but it's it needs to be strengthened. So it was a good experience. Oh, what she did was tape my knee. She taped it. I don't know. You guys can see. Let me see. That's it right there. The tape is, a little bit of the tape is coming off. But she taped my knee, and the tape is, it's to stay on for a while. She said I could shower with it and it won't come off. But she taped it in the area of my kneecap, so the kneecap will be stabilized and wouldn't move so much when I walk and stuff like that. She said I could still exercise with it on and it would be okay. So that was my first visit. My next visit to the physical therapist is not for another 3 weeks. She said then she's going to see how I'm doing as far as strengthening my muscles and stuff. And then she said maybe after that I can start coming to see her maybe once a week. But we'll talk about that then. And she also said that she was going to see maybe about getting a brace for my knee. Seeing about ordering a brace for my knee that would help me, stabilize my walking and stabilize that kneecap and stuff. That was a good experience. It really helped me out. My knee feels a lot better. You guys also know that I pulled my calf muscle about a while ago. That is completely healed. I don't have any more pain in my calf. I'm going to take it easy and not to re-injure it again. But the biggest news from yesterday is because not only did I go to the physical therapist, because I had to go to the physical therapist at about 10 o'clock in the morning. And then I came home, and then I had to go right back out again at about 3:30 in the afternoon to go see my primary care physician. Now, the thing about it is that my primary care physician so many things. Sometimes I really do hate HMOs and stuff like that. They really just give you the business, because the primary care physician that I saw initially was unavailable. So my whole thing was, I like the lady that I saw yesterday, the doctor that I saw yesterday. I like her so much better, and I'm thinking about, really probably am going to change to her. I liked her attitude. I liked the way she gave me the information, and it was just a better experience. So I went and talked to her yesterday and told her, gave her all the updates about me going to see a general surgeon, and getting my mammogram done. She said my lab test said my cholesterol was a little high, but because I'm working on changing my lifestyle and adjusting the way I eat and the fact that I'm getting more exercise in, she said that she's going to wait till like the spring to see that if I would have to be on any medication for my cholesterol. But she's going to give me a chance to work on that myself and to lower my own cholesterol, which I plan on doing. And I seriously think that this 60-day fast will definitely lower my cholesterol, without a doubt. I'm so sure of that. So I was talking to her, and then we was talking about the breast reduction. So I told her what the other general surgeon had told me about with the whole cancer history in my family, and what he was saying about the double mastectomy and the preventative measures and the genetic testing. And she told me what she told me. She was like, well, she asked me the question. She said, well, when was your mother diagnosed? And I told her she was diagnosed like in her early 30s, between like 30 and 35. And she said, well, you're 39, so you pretty much passed that. If you really was gonna develop that because of a genetic trait in your family, it would have probably been detected by now. You probably would have discovered a lump or something by now. Also, with the mammogram, something would have came up, but your mammogram was completely clear. There was no sign of cancer at all in your breast, and your testing, everything was fine. So she said, I wouldn't look, into getting the genetic testing. I really don't think that is a issue, and it seems to be so controversial, because you can't really determine if you're going to contract cancer from a genetic testing. So she eased my mind about that. Then she said sometimes, different surgeons will, try to, just give you all the information that you need to know. So she really doesn't think that the other general surgeon that I talked to was really, she just said it's just something that he was supposed to tell me. It was information that I was supposed to get, and it wasn't intended to scare me in any way. And then she was like, so do you want me to go get this referral so you can go talk to the plastic surgeon about getting your surgery done? And I was like, oh my God, yes. So I was like, yes. And I got the paper, I got the referral to actually go talk to the plastic surgeon. It's in the same hospital where I talked to the general surgeon is. So she put it at the bottom, and it says it right there. Please evaluate for breast reduction surgery. Patient has significant back pain from large breasts. And when I saw that, I was just like, oh my God, yes, 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 yes. So I am going to, today is Saturday, and I got the paper yesterday, Friday. So like Monday morning, I am calling this plastic surgeon, and she's a woman, and I'm going to call her, and I'm going to make an appointment so I can really go talk to her and get this started on the roll. I'm trying not to be as excited because I don't want it to be I don't want to get all the way up to that point, and then for some simple reason, you know, my insurance says no, you can't have the surgery. Yeah, that would crush me, you know. But by hook or by crook, I'm gonna have this surgery, even if I have to pay for it myself, because I will have it. Um, but the fact that the fact that I got that piece of paper, the fact that I got this piece of paper to go see the actual plastic surgeon. The last surgeon I saw was just a general surgeon, and he would have helped me with reconstructive surgery if anything would have happened with my mammogram, basically for the breast cancer side of it. But with a breast reduction, but with any kind of surgery for your breast, you must always get screened for breast cancer and all that, and talk to that side first. I've gotten that over with. That is phase 1. That is done. Phase 2, which was yesterday, which was getting everything else cleared away and finding out results of everything. Everything that is everything that would medically stand in my way from getting this surgery. That was phase 2. Phase 2 is over with. Now I'm going into phase 3. Phase 3 is actually sitting down, discussing the issues of my breast reduction surgery that I so hope to have. I really think it's going to happen. In my heart, I really think this is going to happen this year. My primary care physician said she wants to see, she doesn't really need to see me anymore until the spring, so she can see what's going on. I'm just so excited about this, guys. I'm so excited. It's been a long time coming. Wow. It's amazing. Like, it is amazing. I really am happy about this situation. Oh, my primary care physician, while I was talking to her about getting this referral, I was telling her about the fact that I had lost a lot of weight. You know, from initially, I was telling her that I was about between 315 and 320 pounds in the beginning before my weight loss, and I lost the weight, and the fact that I was losing the weight pretty much in all places of my body except my breast. So she said, she was like, well, you know, she said, well, did you want to, you know, have some skin removed as well? I was like, no, I'm fine. I don't want any skin removed. I don't have any excess skin right now that I'm even worried about. Just the breast. That's all I'm interested in right now. I can pretty much deal with anything else after the fact. Seriously, because that's all I'm interested in right now. I really want to lose this weight and to get this extra 10 pounds on my chest completely gone, or at least lowered. You know what I'm saying? I need to watch what I say. Seriously, I need to really watch what I put out into the universe, because I don't want to say that I want them completely gone, but I do want them significantly reduced so I can handle them. And yeah, I don't need it. I don't want anything else as far as excess skin to be removed, because of with insurances, they don't want to pay for much. They want to pay for what you need, and that's it. So what all I need is this breast reduction surgery. And it's going to be a good thing, guys. It's going to be such a good thing for me. So I wanted to come through and tell you guys that phase 2 of my breast reduction surgery is complete. And now phase 3 will begin the minute I go to consult with an actual plastic surgeon about my breast reduction. And that is what that whole entire appointment will be about. So until next time, guys, I will holler at you in the next video. Alright, peace.